So I just quickly want to share something with you this evening. So it's about the session I had with someone, a one-on-one coaching session I had with someone during the week. So the person said, by the way, this is spinach for amunututu. This thing used to be a thing before. We call it for amunututu. Is our local vegetable, but this kind of vegetable you don't get to see it in the market again. I don't know why. So that's why I decided to plant it. And something about this vegetable is that it has a very nice taste when you cook it. I don't know why Yoruba call it for amunututu. Maybe when you eat it, it's actually, so those of you that are not Yoruba, it means a vegetable that cools your stomach. For amunututu. So it's actually called spinach in English. It's a very delicious vegetable. So I don't know why they don't sell it any longer. So like I was saying, I actually wanted to share something with you about a session I had with someone, a one-on-one session I had with someone during the week. So the person has been trying to lower his blood pressure and blood sugar. So his medication he has been on medication for a while. So he now complained to his doctor because he started having some symptoms which are due to the side effects of the medication he was given. So part of the side effect was I was always feeling very weak. Part of a lot of different type of side effects, and one of the side effects that some of these BP medication can cause is low libido for men. So the interesting part is when he complained to his doctor admitted that yes, it's part of the side effects, but it is what it is. There is nothing you can do about it. He said you either take you need to take one, your health or the side effects. And actually the doctor is not wrong. It is what it is. Those medications has their side effects, but why will you endure those side effects and the long term? We are not even talking about the long term side effects, which are maybe kidney issues and so on, and even heart issues. Yes, your high blood pressure medication can lead to heart issues if used on a long term. So you can imagine you are trying to prevent something, and that remedy you are using is even causing something that is even more serious. You can imagine something like heart issues. And this same thing happened to my mom. She has been taking high blood medication for years. She has been on it for years, and her blood pressure was regulated. It was just that you cannot stop the medication, but her blood pressure was regulated. So all of a sudden she started having serious breathing issues, and we did not even know. We checked her blood pressure, it was okay. So eventually when we got to teaching hospital, that was when we discovered she had heart issues. And one of the major things that can cause this is the medication that she has been on for years. So what I'm driving at is, would you rather stay with something that does not have a long term remedy for you, is not a total cure for you? Would you rather stick to that one with its side effect, or seek for a natural solution that will be a permanent remedy for you. And even while you are trying to seek that permanent solution, that natural remedy, you discover that along the line you have there are some advantages to it, because generally your whole body benefits. So it's not a matter of you lowering your blood pressure again. It's about you giving your body all it needs to strive, to survive, to operate at its optimal what do you call it. So what I'm trying to tell you this evening is that it's not enough for you to just rely on medication alone, no matter what you are going through, especially if it's a lifestyle disease. Lifestyle diseases like diabetes, high blood sugar, pre-diabetes, high cholesterol, high blood pressure, cancer. These are lifestyle diseases, and the major thing that you can do, what you can do that will benefit you on the long run, is to attack it from the root cause. So I was saying something about this vegetable the other time. So I'll be pairing the amunututu vegetable with this amaranth. This is the green vegetable, but this is not the one sold at the market. There are two varieties. This is the local one. This is called tete abalaye, and it has more medicinal benefits than the one we normally buy. But the two of them are called amaranth. Some people call them spinach too. They call them tete or green, but this is the local one, not. And this particular one is even very good for hormonal issues, for females hormonal issues, and it's also improve fertility. So you can see what you can derive from common, what you can, I don't call them common, but what is generally called common vegetables. Yes, you can derive a lot, and this is part of what you can do to reverse or to prevent chronic diseases. Make sure you are adding vegetables and fruits to your diet daily. The other time when I made a live video, maybe like 2 weeks ago, I talked about five what's it called, five I said you need to be taking 3 portions of fruits and 2 portions of vegetable, or vice versa, daily. So if you did not watch that video, it's still on our page. You can go and watch it, and that is one of the ways you can prevent chronic diseases, or you can manage chronic diseases, because it's part of the reason why these diseases develop in the first place is because your body is lacking in some things. Most of the time the food we take lacks major nutrients, they lacks fiber. So those are the things that cause spike in sugar level and high blood pressure issues. So I'm also going home with this I always talk about this holy basil. So I'm going to make a tea with it because I'm already feeling tired, and this holy basil is very good it makes you relax, makes you sleep better. It's very good for managing anxiety related issues, and it's also very good for females generally. So I'm making a tea with this. So I'm also cooking my vegetable fresh today, and it's important that you don't overcook your vegetables. this is very important. You can cook, but cook slightly, so you don't kill all the healing properties in them. So we have been a class coming up. I'm trying to put up this class so that a lot of people can benefit, and I'm thinking of making it so affordable so that a lot of people can benefit, because you know, we need to spread the awareness. A lot of people are unaware about the fact that you can actually prevent all these diseases, even if you are prone to them, and you can actually reverse them. So, and you can do them with your food. So detoxification is part of the thing you need to be doing. So there is a class coming up, and when we start, we are going to make sure it comes with minimal fee. So be ready to join the class, because it's going to be very educative. And after that mini class, we are going to follow it up with a 21-day reverse high blood pressure and high blood sugar diabetes challenge. 21-day challenge. It's going to be very interesting, and I'm so excited to put this together. So thank you for joining me.